VOX, from the beginning, came out of behavioral health. We had very clear convictions about the core tenets of our program. We had very clear conviction about what it is that the patient needs in order to drive compliance and to drive outcomes. You know, in each of these areas, whether behavioral health or healthcare, right, there's no lack of information. The patients typically are getting the discharge plans they need. The plans are in place. What there is a lack of connectivity. So oftentimes in recovery and reintegration models, there's a view that spans across the patient population that assumes a level of intentionality, a level of initiative upon that patient that really only exists amongst a small percentage of the patient population.
Patient education typically has a soft feel. You go to the doctor, they give you a brochure, you walk out the door. If you look at it before you throw it away, that's what patient education has been in many cases. But this is really patient compliance. So it uses technology, and the patient is the user of the system. They're not the customer. The hospital facility or the physician's practice, that's the customer group.
Then some of the real key aspects of the VOX program have really stood out. Again, the fact that it is procedure specific, the fact that we have a significant focus on pre-op patient engagement, the fact that the program is full episode of care. So we really want to envelop that patient. We want to also then create a very useful hub in which we can integrate any other components that the provider wants to bring.
A program like ours establishes best practices, and it automates a program that is really all over the map. I've talked to individuals in doing my research about joining VOX and talked to friends and family that have had orthopedic procedures done. Everyone has a different experience, some good, some bad, somewhere in between, but nowhere has it been automated.
All of the patient educational activities and tasks are scheduled out in the form of a daily checklist on the patient's calendar. So they just have to log in, check their to-do list, perform their activities, whether it be making a necessary doctor's appointment or answering questions about their condition after discharge from the hospital. The VOX educational library is very thorough. It's just full of relevant videos, articles, illustrations, checklists. It even uses interactive teachback. So it really is robust in terms of what the patient gets to help educate and prepare them for surgical success.
We think the coolest thing about VOX really is that it takes the whole process into account. So it takes the pre-operative process, the hospital process, and the post-operative process, and takes the patient all the way through their hip or knee replacement. And if you can have that patient in a better medical state when they go into surgery, if you've got them really tuned up before surgery, which VOX allows us to do, then you're likely going to have a shorter hospitalization, which is a good thing, and you'll likely have a quicker recovery. So VOX is pretty neat because it takes you from start to finish.
Healthcare is changing quite a bit, and to be successful in the future, you've really got to address the changes that are out there. You've got to meet them head on. We've really got to look at the full continuum of care for the patient before they come into the hospital to well after their discharge. It's no longer just the hospital stay. We've got to be dealing with those patients and working with them well before they're in the hospital, so they're prepared, they come in. And then when they're in the hospital, they receive the appropriate care, less anxiety, they have great outcomes. And then once they're discharged, we need to continue following them so we can avoid problems where you have readmissions or any issues with those patients. So basically took the model that we have, has been successful, has been developed over the last 20 years, and it models to take care of that patient well before and after. So you've taken that instrument, that model we have, the patient care handbook and all the care around that patient, and put it into an innovative product. Our clinical team has been highly involved with VOX. Really collaborative, integrative effort to get this thing going.
One of the challenges of how healthcare is developing is the community aspect of providing care. And so outside of the institutions, a hospital or a nursing home, a lot of care is being provided in the home. Home care agencies are now being challenged to try and determine exactly how do we bring best practices, how do we provide the best care we can provide to individuals in the home. Telemedicine and the use of technology into healthcare is very exciting, but it is also rather challenging because we are now building for the very first time platforms and modules to deliver services that traditionally have always been simply provided in and through an institution. Because of where this whole field is and where it's going, I think VOX is really positioned in an incredible place for the future.